Hi, this is Dr. Adrienne. Welcome to Health Bite, the podcast where we explore all things health and wellness. Hi there, and welcome back to Health Bite, our podcast where we discuss all things health and wellness. Today, I am so happy to have my longtime friend, Dr. Sherry, who is also the medical director and founder of the ReLeaf Institute, a medical practice specializing in cannabis use. And Dr. Sherry is here to talk to us about all things cannabis related, medical uses, and so happy to have you here.
Thank you for having me here. This is a wonderful podcast. I'm looking forward to talking with you today.
Yeah, super excited as well. So as we were talking before we started, this is an area in which there is a lot of confusion, a lot of myth, right, and misinformation. So can you just start by teasing out these various words that we use interchangeably, like CBD, THC, hemp, marijuana, cannabis? We use these interchangeably, but of course, they're not interchangeable, right?
That's exactly right. So it's so funny. You've already mentioned about 5 names that we commonly hear for cannabis, marijuana, Mary Jane, weed, pot, all of these different fun names. And the reason why we had all of these different names was because for a long time it was illegal. And so people had to get creative with how they were referencing a product or a plant product that was very much illegal across all 50 United States. So nowadays we're seeing these different changes, and with the different changes is coming a resurface of the science behind it. So back in the early 1900s, cannabis was referred to as cannabis, which is the actual name of the plant. Kind of like you think of parsley, right? There's different types of parsley out there. There's curly-haired parsley, there's flat leaf parsley, but at the end of the day, it's all under the umbrella term, scientific term of parsley. And then you talk about, right, the individual ingredients or chemicals in these different plant types. And that's where those names you're starting to hear, like CBD, THC, that refers to a really specific chemical product, not the whole plant. So cannabis in general is the umbrella term, and then CBD and THC are the very specific chemicals within the plant. Now, there's one other big term that actually is thrown around a lot as well now, and that's the word hemp. And hemp refers to a specific type of cannabis that predominates with the chemical of CBD. Mm-hmm. So very technically speaking, it has to have less than 0.3% THC to qualify as a hemp-based product or plant. And this is really interesting once you get into the legal rules surrounding all of this.
Right. So talk about that. And before though we go on, because I think that's important to address too, just clarify that, you know, the CBD versus the THC, that's an important distinction.
Great. So CBD is one chemical that we know is not euphoric, whereas THC causes euphoria to a certain degree and depending on the dosage you take. So these are the 2 most important distinctions between those 2 chemicals. So think of it as a yin and a yang. So, you know, the white part is going to be CBD and the black part of that yin and yang is going to be THC. And they both fit together really nicely in this plant as products that grow together or chemicals that grow together. But one has a very distinct pattern of euphoria inducing, whereas the other one does not. And I don't use the term psychoactive, you'll notice that. And the reason is that both chemicals actually do take effect on your brain. So in very different ways. So CBD can affect your brain because that's where epilepsy occurs, right? Epileptics have seizures that are caused from brain issues, whereas and CBD will take effect on those neurons in the brain. So right. It is very technically psychoactive. And THC does the same. It can affect the neurons on the brain, but in a different way, perhaps.
And the CBD is not the kind of psychoactive that we are necessarily seeking. It's
right, exactly. That's right. So CBD doesn't cause that kind of high.
Got it. So let's talk a little bit about the legality, right? So because there is a little bit of disparity in what's legal at the state level and at the federal level. And specifically, I think to our audience, what are things that they maybe need to be tuned into or concerned about?
Right. So as of November 2020, we now have 4 more states who've joined the recreational states. And now I believe this is a total of 15 states that are recreationally legal. And what that means, including here in the state of California, what that means is that anyone over the age of 21 can walk into a dispensary or store that sells cannabis products and make a purchase of any cannabis products they like. And again, you have to be over the age of 21. And that makes it recreationally legal, kind of like what you think of when you walk into a store to buy alcohol. On the other hand, we have over 33 states. I believe now, as of November, it's 35 states that are medically legal, which means that you have to have a medical reason according to that state. So each state is different, with a recommendation from a doctor or a cannabis provider, a medical clinic, that will allow you to go and purchase these products, again, through a dispensary in your local area. So overwhelmingly, there are now legal reasons to allow a patient to purchase cannabis products in 35 out of 50 states, which is amazing. And in these 15 states, otherwise that are recreational and medical, you can purchase for any reason whatsoever.
But the state level is separate from the federal, right?
That's
and
right.
There is a discrepancy there.
So then we get into federal level. And on the federal level, cannabis is still very much illegal. It's still a Schedule I drug, which means that there's no medical indication for that. But obviously, we're seeing a lot of discrepancy on that level. Now that Joe Biden and Kamala Harris have been voted in, one of Kamala Harris's agenda items was to decriminalize cannabis on a federal level. So we're looking to see in the next year to 4 years how that's going to change with the rules and regulations in terms of decriminalization. Now I'm going to take it one step further. Hemp. So we referred to hemp earlier as a predominantly CBD product. And those products on a federal level, so all 50 states are allowed to purchase hemp-based products as of 2018, 2019. So you can actually order online across all 50 United States and have it shipped to you a hemp-based CBD product.
I actually recently heard of a company that delivered hemp by bike. That was their niche.
Yeah, that's right. So we're seeing all these different really cool and interesting niches in the cannabis hemp world, which is, organic products, all natural products that are all kosher. There's all these different niches and ways people are getting really creative. And it's so exciting because instead of having, 4 PhD chemists in a laboratory, in the basement of a building doing the design base for a new pharmaceutical product, you now have the entire world, right? Canada is all legal in terms of cannabis. We're starting to see other countries all pop up with their own legalities for cannabis. And in this, what happens is we get everybody's creativity and ingenuity and different ideas sprouting on how to make this a better product line. And even not just better, but individualized and more personalized to what someone may need.
Yeah, I mean, it's definitely a topic and an area that's in fast evolution, which is exciting. But of course, with all that ingenuity, it also allows for irregularity. So what are things that, because it's so accessible and because you don't need to be a chemist, as you say, to do this, what are some of the things that people should be mindful of when they are seeking these, either the CBD or the hemp, right?
Right. So something that's legal for everybody, hemp and CBD.
Right.
The most important thing you're going to look for, just like you mentioned, is consistency and regulations, and to make sure what you're buying is what you're getting. So a lot of times we're seeing, especially about a year or so ago, we were seeing a lot of products being sold that weren't necessarily what they were being advertised as. So if a product was saying it has 50 milligrams per dropperful, for example, does it actually have 50 milligrams per dropperful? How can we tell as a consumer what's real and what's not? And one of the easiest ways for an individual to find out about that is on these websites, you're going to see a certificate of analysis, or if you look into like questions or facts or FAQs, whatever that tab is going to look like on that website, you're going to pull up that independent laboratory analysis. And that independent laboratory analysis is really important to verify what's actually in the product line. And all reputable brands are going to have this. Anybody who's worth their salt is going to have this, because they all know and understand that this is really important as a checkbox. So the certificate of analysis, or the COA, is going to have a lab verification of what's actually in the product. And that's what you're going to look at. Usually it's labeled as milligrams per milliliter.
Yeah, that's really important to look for that, for the COA, because like you said, these are not regulated, they're legal, not necessarily regulated, and it is very much like in my world of weight loss. There are many supplements that are on the market, right, over the counter, and they are not FDA approved or regulated, which means that not only do they not have to necessarily have what they say that they have in the bottle, but that also they're adulterated, meaning that they can have something that's harmful. And so I imagine it's the same, that you worry about adulterated products. So that COA is what's going to kind of give you the assurance that that's not the case.
That's absolutely right. And so they'll also check off for different pesticides in their product lines, and what other minor cannabinoids, we haven't talked about that yet, but the other cannabis type products or chemicals that are also in that product line. So these are all things that we're starting to see and understand, as even every month comes on, we see new cannabis-based articles and research out there, and where all of that is going, because there's over 150 phytocannabinoids out there that we're seeing. There's over 400 chemicals, including terpenes and flavonoids, right? And this is where I think a lot of the nutrients and supplements overlap with cannabis. And what we're starting to see is being beneficial. You talk about, I'm sure you even talk about things like black pepper. What's your take on black pepper?
Right. Well, I know that it really helps release the curcumin in turmeric, for example. So it increases bioavailability.
Right.
Somebody just yesterday, a patient of mine was asking me about black pepper seed for weight loss. I'm pretty sure there's no data on that.
Right. But it's this idea that, we think about things in just isolation a lot in medicine. Like you have to just take this one chemical component or one medication. And what we're starting to see both in the nutrient and supplement world, as well as the cannabinoid world, is that maybe these things work better together. And, why aren't we thinking of things as layers of medication, even or supplements, as opposed to just one thing in isolation? So perhaps we can use a smaller amount if one thing helps the other thing work better.
Right, absolutely.
And so black pepper example was, we do see parts of pinene or black pepper in the cannabis plant as well. And we're seeing that as a little bit of an anti-inflammation.
You know what I love about that is that how nature has its own way of cohabitating these nutrients within the same plant. I mean, I think that's so wonderful.
Oh, absolutely.
Yeah, it really is. So when I think about CBD, I think about the father in My Big Fat Greek Wedding. I think about the Windex, right? Like CBD oil has become like the Windex in My Big Fat Greek Wedding. It's good for everything, right? So I think it would be helpful because there is some data out there. It isn't, in fact, proven to be good for everything. So what are some of the areas in which this is most effective and has been studied?
Right. That was actually one of my big questions going into this field. I was like, how is it just like that Windex? Like, how can it be good for everything? It doesn't make sense. Like, how could it be good for cancer and nausea and vomiting, but also be good for arthritis? Like the things that totally seem, with zero overlap whatsoever.
My grandmother actually has a cream like that too, a cream that works for cancer and arthritis.
Right, exactly. And you're just like, that doesn't make any sense in my mind because those things don't overlap, especially in medicine where you think of these things as very separate entities.
Right.
And one of the most interesting things I found when I first kind of delved into cannabis was that we do see these cannabinoid receptors in all different parts of our body. And that was a really important fact for me, was that Oh, we have receptors in our bodies that respond to cannabis because we actually have an endocannabinoid system in our bodies that mimic, rather the phytocannabinoids mimic our body system, not the other way around. But we do have these receptors on our joints. We have these receptors on our GI tract. We have these receptors in our brains. We have them in a lot of other areas too, but that's why you see a lot of these things being, advertised as this is good for this and something completely different. Mm-hmm. So going back to where kind of some of the research is and where the focus is in cannabis, it's a little bit odd, but Epidiolex is probably making the biggest headline right now in the medical world. Epidiolex is a pharmaceutical version of plant-based CBD. And it's the extract that is very much similar to or akin to a lot of the other CBD oil tinctures we see out and available on the internet. And the biggest difference is going to be cost, one, and two is dosage or concentration. So Epidiolex comes in about 10 to 20 times the concentration as what we see on the market today. And it can be covered by insurance, but otherwise is very expensive. You're talking about $22,000 to $44,000 a year.
Holy cow.
For somebody who doesn't qualify, which is the overwhelming majority of people. So CBD or hemp-based CBD in research and in science right now is garnering a lot of attention. Epidiolex, the indication is for Dravet syndrome and Lennox-Gastaut syndrome. You probably have no idea what those two are, is because they're
random. We heard them in medical school, right?
That's exactly right. They're two very, very specific super seizure disorders. I mean, this is like you're talking about 50 to 100 seizures a day. And mostly affects young people because they don't live very long with this disorder, both of these disorders. So in general, you're looking at epilepsy, and CBD is garnering a lot of attention. Last year, UC San Diego gave away about 5 grants on CBD-focused studies, research studies, to a variety of different researchers across the California landscape. So you're seeing CBD for arthritis getting a lot of new attention and focus, and that's going to be one of the studies coming out soon. CBD for insomnia, and we're going to see how that plays out. And then we're going to do CBD for pain management. And a lot of studies have been coming out of New York and NYU, very specifically at Mount Sinai University with Dr. Yasmin Hurd. She's doing a lot of focusing CBD for heroin treatment, for withdrawals, for rehabilitation, for maintenance, as a maintenance drug to get people off of opiates.
Yeah, and those are the areas that you commonly hear CBD being touted for. And so do you think, you reference all this ongoing research that will be done or is ongoing, but do you think the data is there for the general guy out there who's not seeking CBD for seizure or epilepsy, but for these common maladies like joint pain, for insomnia, which is, over a third of our population is suffering from insomnia these days. What are your thoughts on using CBD, and in what form? There's oils and there's, orals. So what would you recommend?
So this is where the devil's in the details, right? You mentioned a third of our patients have insomnia, but they have insomnia for a wide variety of reasons. Some have anxiety-related insomnia, some have, sleep disorders, some have pain-related insomnia. They wake up because they're having pain. Some are having insomnia because of their, neuroatypical situation. And so the breakdown is really important as to why the insomnia is coming about. And what I find is things like CBD is not all it's cracked up to be for all of those different reasons for insomnia. So patients with anxiety-related insomnia, CBD can be very helpful because it tends to be really quieting for our anxiety. It tends to be really much more of a relaxant without getting you to kind of step over to getting high, right? So that's where it breaks down.
And in what form do they know that it's most effective for anxiety-related insomnia? Is that something they've found?
It's really not about the form in that situation. So form it has to do more with how quickly you want it to take an effect. So if you need something to work fast, inhaling a product or putting it under the tongue is going to work faster than ingesting it. Ingestion takes almost up to 2 hours to take effect sometimes. So you have to be really aware. And people who are anxious, people who have nausea and vomiting need effectiveness much more quickly. Sometimes when people are having a panic attack, they can't wait 2 hours to take effect, which is why Ativan and Xanax tend to be very preferable sometimes, because it works fast, right? When you're anxious, you need something to work fast. So how fast do you want something to work? Xanax and Ativan both work really fast. And so what I find the biggest mistake people make is they take a CBD or a THC product as an ingestible, and then it doesn't work fast enough for them. And so they take something else on top, or they take a second dose on top. And then all of a sudden they've overdone it. And the overdone it part can be a little scary.
Where do the topicals and the oils fall in terms of efficacy, or not just efficacy, but just rapidity of use, like how quick the onset of the effect is?
The topicals are probably one of my most favorite underutilized products. Topicals can be very effective for migraines and headaches. They can be very effective for joint pain or muscle aches. If you go out for a run and you're a little too sore, sometimes even after I get my flu shot, I get a lot of soreness in my shoulder, and I'll throw a little bit of CBD topically on it, and it really helps kind of soothe that feeling of achiness. And if it works in about 20 minutes. So it doesn't work for everybody, right? This isn't a magic cure. It works for about 70 to 80% of patients, and which I think reflects a really great response rate for a lot of individuals, which is why we see the general public as kind of really embracing this as a medication. But every once in a while, you'll meet somebody who says, oh, I've tried it before. I smoked it when I was really young, and it made me really paranoid or really anxious or really uncomfortable, and I just didn't like how it made me feel. And that doesn't mean that, you can throw the baby out with the bathwater. Sometimes that really reflects how THC sits with an individual, and CBD will actually have the exact opposite effect for patients. So if you tried smoking something in your youth and you didn't really like it, you probably may want to try CBD, because that may have a better kind of effect on you as an individual.
And then also it sounds like the topical, I mean, even though you say that with the certificate that there is a reassurance, I think most people would probably still feel comfortable if they're not in this world yet or haven't explored, to use a topical as a initial gateway, right?
Right. And so the topicals are nice because you don't have any systemic effects. So you don't feel it at all. It just really works on a very targeted area. So it'll only take effect on wherever you apply it.
So localized pain, joint pain, we talked about insomnia, particularly when it's anxiety related, headaches. These are any areas that you didn't mention that you think are up and coming or that are currently well studied?
Cancer is a big issue, and then weight loss. We'll get back to your personal favorite. Mm-hmm. So cancer, chemotherapy agents now are not kind of as dramatic in terms of nausea and vomiting and pain as they used to be back in the 1980s. We've done a lot better with our general chemotherapeutic agents, but that doesn't mean that it doesn't make you feel unwell after a period of time. And, people get really tired and uncomfortable. So with radiation treatment, with post-operative treatment with cancer, with just general chemotherapeutic agents, this is the biggest reason why cannabis in general as an umbrella came through to pass for medical indications. So I still think it's hugely helpful in those patients. And we're just starting to see research about cannabis, be it THC or CBD, as a very specific anti-tumor agent. We're still not there yet, but we're seeing the reason why it can be a potential anti-tumor agent, which is really amazing. And then nowadays, we're even starting to see some thought about CBD being an adjunct in weight loss, which is really interesting.
Yeah, it is interesting because you probably know that several years ago, there was a medication that was going through FDA testing for weight loss that affected the endocannabinoid receptor that you were talking about, but it caused dysphoria, it caused depression. And so it didn't
severe depression, right? And severe suicidality, right? So it was really a big problem. And the interesting part was that was actually like an antagonist or a blocker to THC, because we know THC helps enhance the appetite. And so what they figured was, okay, if we block something that enhances the appetite, then it must be a great appetite suppressant. And that was the problem with that one. But the flip side is like, again, the yin to the yang, you know, where THC is an appetite stimulant. What we're seeing in terms of CBD is not so much that it's a suppressant for the appetite, but maybe it may help your pain so that you can get out and walk more. I had one patient who was, you know, overweight and was trying all these appetite suppressants, but the problem was she couldn't walk because her knees were bothering her all day, every day.
And so it's so important really to tease these things out, because I think people will maybe even hear us talking and say, oh my God, CBD is going to help me lose weight, or oh my God, CBD is going to help me sleep. But again, as you mentioned, the devil is in the details. There's nuances there in how these things are going to help or why they're going to help. But I want to get to this point also before we wrap up of, you know, interactions. And I mean, you mentioned cancer patients using it for nausea. Do we worry about people who have finished chemotherapy, they're neutropenic or their counts are really low, so they're susceptible to infection? Or even for the general guy out there, what are potential side effects or interactions? And also a reminder that at the end of the day, even natural things are active, are physiologically active, and they can also interact with medication.
Absolutely. So absolutely. Plants interact with other plants. We get most of our medication from plants. Digoxin comes from a plant. You know, all these medications originated, penicillin originated from fungus. So we really depend on plant and animal life in order to create new medications. So it's really important. And one of the reasons why we want to also make sure, you know, if you're taking any other medication, it's always a good idea to double check about those interactions with your doctor, number one. Number two, CBD in large dosages especially does interact with other medications that get broken down through the liver. So if you're on a medication that you know gets metabolized through your liver, you want to be really conscientious, which is many of them, right? That's exactly right. So you want to be conscientious about especially the dose of what you're taking. You know, we think of it as a very benign plant-like thing, but when you get, you know, you can start at 5 milligrams of CBD and go upwards to 100 milligrams of CBD per dose. And when you get to those, you know, 40, 50, 60 numbers, it really can potentially interact. And that's not to mean to scare people off from trying this, but it's just to be mindful of what you're taking.
Right, absolutely. I mean, I think whenever there is more availability of anything and it becomes more commonplace, then there is the opportunity also for more interactions, for more adverse effects. And so I always think that even if these things are readily available and accessible online, that it's probably a good idea to have a conversation with your physician, or better yet, because most physicians aren't so savvy to all of this as I am not or was not, for them to consult with someone like Dr. Sherry, who really specializes in all of these nuances. So for people out there who are interested in using CBD or learning more, how can they find out about you? How can they reach you?
Great. So they can reach me at Sherry, SHERRY, at MD ReLeaf, like the leaf on a tree. So MDRELEAF.com, or the ReLeaf Institute, spelled the same way with a leaf on a tree.com. Or you can actually reach out to your local cannabis physician. And one of the ways to find them is through the Society of Cannabis Clinicians. And you can find them at cannabisclinicians.org. That's another easy way. There's a find a physician near you part on the website. And that way they can be a little bit more fine-tuned to what's available in your local area.
Yeah, and I do encourage people, again, if they're making use of CBD or even medical marijuana and all the variations, that they do reach out and check out Dr. Sherry's site at MD ReLeaf, so that you can get the medical refined aspect to all these nuances we discussed. It was so nice to have this conversation. Thank you for all your wisdom and pearls.
Oh, my pleasure. Thank you for having me. This is such a great podcast.
It was a pleasure. And so for those of you out there who enjoyed this podcast, please share. You can also find us on Dell Nutrition, where you can sign up for our newsletter, learn about future podcasts, and get health tips and inspo. I look forward to seeing you all there. Thanks again.